First, mahalo to everyone on, the work that you folks do is so much appreciated. Those who are incarcerated, they're super important to me. Those folks are just as much part of the community as anybody else. So I appreciate all the work you folks do. Thank you so much. So, if Hawaii Island Community Health Center, which is the new name from Bay Clinic, we'd like to be a partner. And, being part of Going Home Hawaii has given me more insight into to what the mission is about and how we can be supportive. So just a brief history on how we merged. So Bay Clinic's been around for almost 40 years. West Hawaii Community Health Center has been around for almost 20 years. And, we are both federally qualified. We're a federally qualified health center, which means, technically we're employees of the feds. But that also means that we get a nice reimbursement for serving those on Medicaid, and also extra for serving those who do not have insurance. And so our goal is to really support those folks who need health care regardless of their ability to pay. As I was listening in, some of the challenges of our folks who get released, they need health care. So I'd like to, dive into how this merger came about. So I went over to West Hawaii, during the COVID. I asked, let's collaborate because of this pandemic, right? So joining forces showed me that, hey, we could work together. So we provided vaccinations for places where nobody else could go, down Miloli'i. I mean, no electric, no running water, but we took electric and water and set up internet and made that happen. Went to Na'alehu, went to Maku'u Farms, Farmers Market, went down Keaukaha, Kealakehi. So we just kind of provided services where, bringing the vaccinations to the people. So then I thought, wow, I mean, if we can do that with COVID, maybe we could do that with everything else. And so I pitched the idea to the CEO, Richard Taff, and the first thing was like, well, how is Bay Clinic doing? You guys in financial? I said, hey, we're doing the best we ever have been financially. Morale-wise, our team's coming together, people feeling pretty good. Community-wise, I think we're much more connected to the community than ever. It's like we're operating on all cylinders, and same with them. So of course the question was, who's gonna be the CEO? Well, my thing was, you could be the CEO. You've been there 17 years. So West Hawaii Community Health Center, Richard Taff has been the CEO ever since it started. Bay Clinic, we may have gone through 6 or 7 CEOs, so us a little bit more transition. That's because we've been around longer as well. But by combining forces, it allows us to have more access to physicians, have more access to psychologists, social workers. West Hawaii they have an awesome substance abuse program where they treat those who are addicted to opioids. And so we're looking forward to see how we can benefit from that program. They have expertise. We do not. We have expertise. They don't have. We have a great pharmacy. We have an in-house pharmacy. So we basically can share expertise back and forth. We have 10 sites on this side of the island. They have 8. So together we have 18 sites. And if somebody, that belongs to the east side, needs services, if they go on the west side, they can easily go to any of those sites. So very fortunate to be in this merger. So far, so good. There are a lot of, bumps along the way, like which, HR handbook we're going to utilize. I mean, like things like that. We're at that level now in terms of deciding, which is better, that kind of thing. So, but other than that, I mean, that's in a nutshell. I wanted to just we have a board member that's also on, and that's Brandy Manino. So she could answer questions from the board member perspective. But if you folks have any questions, any thoughts, feedback, now's a good time to share. Before that, though, let me just also share what I'm doing now. So Vice President of New Business Development, which means, I'm just open to everything and anything that can provide better access to care for those who live on our island. And I see every opportunity as a business opportunity / access to care. So that's why I'm here too. But there's one big side note that I'm a psychologist, also used to provide services for our community, substance abuse services, mental health services. So I have a passion for folks who are suffering or mental health issues is a challenge, as well as substance abuse issues. So I'm going around doing trainings on this crazy drug called fentanyl. And I don't know if you saw me in the paper, but I've been on the front page, West Hawaii. Now there's rainbow fentanyl. And a reporter asked me, "Hey, have you seen rainbow fentanyl?" This was about 8 days ago, and I said, "We haven't seen it. It's just a matter of time." And then 5 days ago, we found it in Kona, and then we found it again this morning. And it's a pretty tough drug because one person every 13 days are dying on this island because of that drug. And the most recent statistics as of last week is now one person every 11 days are dying because of an overdose, mostly associated with this drug. So most of my time, I'd say 60% of my time now, is dedicated to providing awareness to our schools, to our other health entities, to providers about this dangerous drug, and getting people aware that now they're finding this drug in almost any drug. And so that's why prevention is key. And that's what I'm doing now. Anyway, I'll turn it over to you folks for questions. Or Les, is there anything else you want me to cover?
Well, maybe you can talk about how some of the justice involved interact with the community health centers, or if there are any, or if there's some other needs that we can look at. Yeah, so
when we was Bay Clinic, right? So the challenge is we got to make sure that the services that we provided when we was Bay Clinic, for East Hawaii, it's going to carry over. So our outreach team was pretty active with the justice involved. We would go into the prisons, into the jails, provide training, give pamphlets, flyers, kind of help to be that bridge. So when they get out, at least they're connected to our health center. And so we still have that as part of our mission. And so, it's just a matter of getting the other side, West Hawaii, to jump on that initiative. So I'd say we've been more active on this side than on the west side. So, but yeah, we definitely continue to look at that as one of our primary outreach entities.
Well, on the west side, we have our program that is right on the street. So we have been using West Hawaii Community Health Center at the time a lot. So I know we're connected there. I don't know if I know that they do a lot of street outreach and other kinds of partnerships with Hope Services and other partners. So we're happy to have that collaborative partnership. And maybe they can also join us in the consortium over in West Hawaii. That would be helpful too, because it's a huge, important piece of everything that we do there with healthcare. So we're kind of early, which is, I think, is good. I'd like to open it up to some questions. Go ahead.
I just had a question. It's not related to this presentation. Is that okay?
Sure, go ahead.
Okay. I was just curious about what kind of volunteer help you were seeking for the dinner on the 14th of October.
Oh yeah, sure. And it'll be like signing in, just setting up tables, the centerpieces, the table tents, and those kind of things. Yeah. Not a whole lot. We don't have the silent auction this year, so there's not a whole bunch of little, things to sell. So that took up a lot of energy and time. So we're not having that. We're just having a few items to live auction. Oh, and also volunteers, if you have any kind of contacts for getting somebody to donate, like a zip line or a boat cruise or a new car or anything like that, would be great. Used car too.
And if you guys have questions, again, I put my email and my cell phone number on the chat. So, I can be questions about the connection with our health center, but also if you need if you want a presentation, I got it down to 30 minutes for staff. I can get it down to 20 minutes for the youth on this very dangerous drug, fentanyl, and the things to be aware of. I'd love to do that free of charge, any place, anywhere on this island, just because it's such a dangerous drug. So thank you, everybody.
Wait, I have a question. I can ask a question real quick.
Sure, go ahead.
Do you notice I'm working on this like harm reduction toolkit for Native Hawaiian communities specifically, but it'll be available for all communities. And right now it's missing a section on fentanyl, which I have to still do. But I'm wondering if there are any particular like approaches to that in the community that you're finding are more effective, or like, would you have any advice? Or also, can I send you a copy of my toolkit and you can tell me what I need to put in?
Yeah, just send me the copy and I'll tell you where I tell you, me going into the schools and talking directly to parents and sharing my story. I get nieces and nephews, I get cousins, I get siblings even that struggle with, I bet I can do a survey and we all would know somebody that we love that is stuck on addiction or has been stuck or in recovery. So I think that's the best way is to get out and just talk to people, for me. But yeah, definitely a toolkit would be helpful because then it empowers other health entities and organizations to see what works and to replicate that so that more folks are kind of getting the word out. So yeah, please send it to me. I'll be happy to take a look at it.
Okay, awesome. Mahalo.
Okay.
Hi, I wanted to say thank you, Dr. Kimo, for sharing for your presentation. You did mention that you will have a presentation on fentanyl. When is that scheduled for?
It's all specific to whoever makes the request. So like, for example, the Department of Health, Child and Adolescent Mental Health Division, Rochelle Agregado has requested a training for her staff. So October 5th, we just locked it in this morning. I'll be zooming in and doing a training for her staff. Again, 30 minutes max. I think you'll benefit from it. Everybody will benefit from it because it's the latest best practice kind of evidence on how to stop this drug and the latest on brain development and how gateway drugs actually set the stage for drug overdoses like fentanyl. So just contact me directly and give me an audience and I'll do it Zoom or in person. I'll be there.
Okay, thank you. Because, just recently, people that I'm acquainted with, people I've known over the years, they've shared with me that they've experienced using fentanyl. And with the statistics that you just shared, 1 out of 11 die. It's concerning. So
yeah,
I need to educate myself.
For sure. And it's 1 out of 11 on this island. And then what I'll do also with the presentation is I spend about 5 minutes. I share with them how to use Narcan. So Narcan is a device. It's basically reviving the dead. I mean, it gets them from being passed out to, to pretty soon cannot breathe to basically come back because Narcan basically stops it stops the neurotransmitters from going into the, and it just reverses it. So if I can just train them on it, then I can give them free Narcan. So if they're out on the streets or maybe at home, if you're on kupuna, and if and it doesn't hurt, can be somebody who just sleeping, and when I demonstrate it on myself, it doesn't hurt. So why not try it if you don't know somebody is, passed out because of an overdose. So I also provide training on that too. So yes.
Okay, I'll be in touch. Thank you.
Okay.
Okay, Kat.
Hi, Kimo. I'm wondering if you ever meet with the judiciary or the Department of Public Safety's line staff to actually explain a lot of stuff about fentanyl and other drugs, because I think a lot of people don't really understand.
Yeah, so I just trained all the sheriffs on the island 2 weeks ago. And then, by the way, Les, October 14th, I know we get our event nighttime, but in the morning, I'll be heading over to Waimea and training all the probation officers on the island for their annual probation officer meeting. So yeah, so to answer your question, I mean, when I did the training for the sheriffs, they was all like, oh, this is some good training, because, I try to make them engaging and make them laugh a little bit.
The judiciary, they need you.
Yeah, so yeah, for sure. So that's already in the works. Thanks for asking.
Thank you so much. I met the judges.
Judges.
The judges.
Yeah, that'd be good. Get me in front of the judges. I'd love to do it.
Okay, that's a challenge. I will email the CJ. Okay.